Hello, today we're going to focus on an important topic concerning health, knee pain. This discomfort, which can affect our lives and limit our daily activities, is a common issue for many people. But fret not, because in this video, we'll navigate through how to manage knee pain step by step. Understanding and managing knee pain begins with grasping the underlying causes and triggers of this discomfort. Exploring the potential reasons behind knee pain is crucial in determining appropriate treatment methods. However, there are also some key points to be mindful of. In this video, I'll share tips on how to prevent and alleviate knee pain. Additionally, we'll discuss some common mistakes that can exacerbate the pain. So, continue to follow along with us to learn how to tackle knee pain for a healthy and active lifestyle. Remember, knowledge is power for a healthy and happy life. Now, let's dive into understanding and managing knee pain. Don't rest too much. Too much rest can weaken your muscles, which can in turn increase re-injury. Find an exercise program that is safe for your knees and stick with it. If you're not sure which motions are safe or how much you can do, talk with your doctor or a physical therapist. Do exercise. Cardio exercises strengthen the muscles of the heart, but not the joints. It is weight training mixed with keeping your muscles limber. Cardio is important for keeping your weight stable and you feeling stronger overall. For cardio, some good choices include walking, swimming, water aerobics, stationary cycling, and elliptical machines. Tai Chi may also help ease stiffness and improve balance. Don't risk a fall. Having a painful or unstable knee increases the likelihood of falling, potentially leading to further knee injuries. Minimize the risk of falls by ensuring adequate lighting in your home, utilizing handrails on staircases, and employing a sturdy ladder or footstool when reaching for items on high shelves. Do use RICE. Rest, ice, compression, and elevation is good for knee pain caused by a minor injury or an arthritis flare. Give your knee some rest, apply ice to reduce swelling, wear a compressive bandage, and keep your knee elevated. Do not gain too much weight. If you're overweight, losing weight reduces the stress on your knee. You don't even need to get to your ideal weight. Smaller changes still make a difference. Do consider acupuncture. This form of traditional Chinese medicine, which involves inserting fine needles at certain points on the body, is widely used to relieve many types of pain and may help knee pain. Don't let your shoes make matters worse. Cushioned insoles can reduce stress on your knees. To find the appropriate insole, speak with your doctor or a physical therapist. Do play with temperature. For the first 48 to 72 hours after a knee injury, use a cold pack to ease swelling and numb the pain. A plastic bag of ice or frozen peas works well. Use it for 15 to 20 minutes, 3 or 4 times a day. Wrap your ice pack in a towel to be kind to your skin. After that, you can heat things up with a warm bath, heating pad, or warm towel for 15 to 20 minutes, 3 or 4 times a day. Don't jar your joints. High-impact exercises can further injure painful knees. Avoid jarring exercises such as running, jumping, and kickboxing. Also avoid doing exercises such as lunges and deep squats that put a lot of stress on your knees. These can worsen pain and, if not done correctly, cause injury. Do get expert advice. If your knee pain is new, get a doctor to check it out. It's best to know what you're dealing with ASAP so you can prevent any more damage. Don't use too many stairs. Climbing stairs can exert significant pressure on the knee joint, exacerbating pain for arthritis sufferers. A study published in the Journal of Orthopedic Research emphasized that excessive stair use can accelerate joint degeneration. Whenever possible, opt for elevators or ramps and minimize stair usage to protect your knees. Don't sit cross-legged for long. Sitting cross-legged for extended periods can place undue stress on the knee joint. Prolonged cross-legged sitting can lead to stiffness and discomfort. A study in the Journal of Physical Therapy Science cautioned against maintaining such positions, particularly for individuals with knee arthritis. Don't rely on oil massages. While massages can provide temporary relief, oil massages alone won't address the underlying causes of knee arthritis. A study in the Journal of Alternative and Complementary Medicine noted that massages can be beneficial for pain relief, but they should be part of a comprehensive treatment plan rather than the sole solution. Thank you for watching. Being knowledgeable about managing knee pain is an important step towards maintaining a healthy lifestyle. In this video, we've shared valuable information on alleviating and preventing knee pain. Additionally, we've discussed some common mistakes that can exacerbate the pain. Remember to prioritize your health and consult a professional when encountering any health issues. Keep making informed choices for a healthy and happy life. We wish you all the best, and we'll see you in our next video.